I will now yield 2 minutes to my good friend from Georgia, Mr. Carter.
Without objection, the gentleman from Georgia is recognized for 2 minutes.
Madam Speaker, I rise today in strong opposition to the Inflation Expansion Act, which includes deeply troubling proposals that will kneecap medical innovation and harm patients' access to cures. Madam Speaker, for 40 years, I was behind the counter. I was the one who had to tell the patient how much their prescription was going to be. I was the one who witnessed the senior citizens trying to make a decision between buying their medication or buying their groceries. I was the one who had to tell the mother how much the antibiotic was going to be and see her in tears trying to find the money to pay for that antibiotic. I know all too well about prescription drug prices. Today, I'm behind the podium as my Democratic colleagues decide whether to mortgage those same patients' health and well-being for a political win. This is immoral and it must be stopped. The United States leads the world in medical innovation. I've watched it. I've seen it as terminal illnesses became treatable with a simple pill. I've seen the relief on the patient's face when they hear that a new treatment is available for their once incurable disease. This bill eradicates hope. Madam Speaker, we need to help lower drug prices and costs for patients, but this legislation goes about it in all the wrong ways. Pharmaceutical companies are the drivers of innovation that deliver life-saving cures to patients. However, this legislation will result in dozens, possibly hundreds, of fewer cures over the next decade. I tried to fix this self-imposed problem in the Rules Committee on Wednesday, but it was rejected. I also introduced an amendment to block the federal government from...
All right, folks, this is Buddy Carter, congressman from Georgia. He was actually on our set in studio, I think it was a week ago, maybe been a week ago today, but certainly last week. And he is making the argument that when you hear that this, the great part of this impending act to pass is that it's going to keep down costs on prescription drugs. He is making the argument that goes counter to that, which is, folks, if you are limiting how much you're going to pay on some of these prescription drugs, if it goes too far, what will happen is the pharmaceutical companies will not develop new kinds of drugs, new kinds of cancer fighting or whatever the malady might be, that's what's going to happen as a result. So he's making that argument as this goes on the floor today. These are the impassioned arguments that are being made before actually voting on the bill, which is expected today, already passed the Senate, but not all of this is settled in a lot of minds out there.